Now I want to go through some of the most stressful symptoms from the lower urinary tract, the different types of incontinences that patients can have. The first type is urgency incontinence. Urgency incontinence means that the bladder is signaling to the brain that there is some kind of feeling that the patient has to empty his bladder quite fast, often also. And this is called urgency, as you remember. So the bladder signals urgency, and the brain cannot tell the lower urinary tract to keep the urine in the bladder. Instead, there will be a following leakage of a few drops or a couple of milliliters usually after the feeling and sensation of urgency. The next type is stress incontinence. Stress incontinence is when the tightening mechanisms, the sphincter mechanisms below the bladder surrounding the urethra in males and females is weak. When the muscular power within these systems is too weak, then there will be leakage when the pressure within the abdomen increases. For example, during exercise, heavy lifting, laughing, and so on. The next type of incontinence is when the patient both has a weakening of the power of the muscular system below the bladder and gets the feeling of urgency just before the leakage. That is called mixed incontinence. The fourth type of incontinence is overflow incontinence. That means that there is some kind of dysfunction in the lower urinary tract, making the bladder unable to contract and expel the urine. If it is full with urine and cannot contract, then there will be at one time during this situation, the pressure within the bladder will overcome the pressure within the urethra, and then there will be a sudden leakage, usually quite small leakage to the outside, and quite frequent. That is a typical situation where the patient has overflow incontinence, a very serious symptom from the lower urinary tract. The fifth type of incontinence is incontinence at nighttime. Incontinence at nighttime is called enuresis. The last type of incontinence I want to mention is post-micturition dribbling, a symptom that belongs to the post-micturition symptom group in Lutz. These symptoms, post-micturition dribblings, happens after the patient has emptied his bladder. It is more common in males than females due to the fact that males have a longer urethra. The reason for post-micturition dribbling is that there will still be some drops of urine in the urethra after emptying of the bladder. And these drops comes out when the patient starts to move after micturition. That is post-micturition dribbling.